In this video, we will show you the basic exercise program you should perform after knee surgery to help you recover. Do the exercises slowly with control and don't forget to breathe. You should perform these exercises 3 times per day. Begin the ankle pump exercises by lying down on a flat surface such as your bed with your knees straight. Move your ankles up and down to point and flex your toes. You can also move your feet in circles. Repeat continuously 10 to 20 times. For quad sets, start with your operated leg straight on the bed. Tighten the muscle at the front of your thigh as you press the back of your knee down into the bed. Hold for 5 seconds. Then relax the muscle. Repeat this 10 to 20 times. For heel slides, bend and straighten your operated leg by slowly sliding the heel along the surface of the bed. Repeat this 10 to 20 times. To complete the short arc quad, you might need to get some help to place a folded pillow or a large towel roll under your knee. Lift your heel off the bed until your knee is as straight as possible while keeping your thigh and knee rested on the pillow. Then lower your foot down slowly, avoiding letting it drop rapidly. Repeat this 10 to 20 times. To complete a straight leg raise, start by bending your non-operated knee so the foot is flat on the bed while your operated leg is resting on the bed. This will relieve pressure on your low back while doing the exercise. Then lift your operated leg straight up in the air to the level of your opposite knee and lower back down slowly. Repeat this 10 to 20 times. You may also use a strap or gait belt around your foot to assist if needed. For knee extensions, start with your feet flat on the floor, then lift your foot forward until your knee is as straight as possible. Lower back down slowly. Repeat this 10 to 20 times. For the knee flexion exercises, firmly plant the foot of the operated leg onto the floor and slowly scoot to the edge of the chair until the knee bends and a stretch can be felt. Hold for 20 to 30 seconds, then relax. Repeat 5 times. An alternate way, if there is room under the chair, is to move the foot of your operated leg back under the chair to get the knee to bend. You can assist this foot with your other foot by gently nudging the foot back. Be careful to move slowly and not to force it. To perform prolonged knee extension, place a stool, ottoman, or chair a foot or so in front of you. Put the foot of your operated leg on top and have your knee pointed straight up toward the ceiling. Straighten your knee as much as possible. If you are able to straighten it fully, you may also gently lean forward and feel more of a stretch. Hold for 20 to 30 seconds, then relax. Repeat 5 times.